I'm Barbara Easterling, President of the Alliance for Retired Americans.
And I'm Gerald McEntee, President of AFSA.
Remember the scary movies of the 50s and 60s?
Invasion of the Body Snatchers.
The Birds.
And my personal favorite, Frankenstein meets the Space Monster.
Even though those movies were pure fiction, they scared people stiff. After Psycho came out in 1960, many people wouldn't take showers for months.
Today, we're being scared by a whole new type of horror fiction, healthcare horror.
Take over.
Socialized healthcare.
Death path. Socialist.
It turns out these healthcare stories are just like the old horror movies, pure fiction. It's time to sort the fact from the fiction.
Fact number one, health insurance reform does not threaten Medicare. In fact, it strengthens Medicare by adding new benefits, by reducing waste and fraud, and by making sure doctors will always serve their Medicare patients.
Fact two, health insurance reform is not socialized medicine and doesn't call for everyone to be in a government-run health plan. In fact, it continues our current American system that's based on private insurance, but with a new public plan option that's only for people who want it. Most Americans will continue to get the coverage they do today. Employer coverage for working people and Medicare for seniors.
Fact number three, health insurance reform won't ration care or create so-called death panels that deny treatment to older people. In fact, reform will expand the services that must be covered.
Health insurance reform won't bankrupt the country. It actually saves money. In fact, it will save money for Medicare without cutting benefits or raising co-pays. Other measures will reform the way the insurance industry does business, making it more difficult for insurers to deny or cancel coverage. This means more Americans will be eligible for quality, affordable coverage. But contrary to some of the stories out there, illegal immigrants won't be eligible. Turns out, health insurance reform will help seniors, not hurt them. Instead of a horror show, it's an old-fashioned flick for the good guys. Seniors win.
Seniors win because reform will end the donut hole in Medicare Part D, dramatically reducing both the costs and the anxieties associated with purchasing expensive prescription drugs. Drug companies will be required to offer seniors substantial discounts. Seniors win because reform will provide affordable health care coverage for early retirees, those 55 to 64 who aren't yet eligible for Medicare. And seniors win because reform will streamline and simplify paperwork and cut the bureaucracy for you and your doctor, saving money along the way.
Seniors win because reform will strengthen the financial health of Medicare by reducing waste and catching fraud. Reform will also end outrageous overpayments to insurance companies. Seniors win because reform will add a long-term care benefit that will help seniors stay independent in their own homes.
Seniors win because reform will end all copay for Medicare preventive services, like cancer screenings. These services can find illnesses early when they are more treatable and curable.
Seniors win because no one will come between you and your doctor, not the government and not insurance companies.
To learn all about how seniors will be helped, not hurt, by health insurance reform, go to the Alliance website, www.retiredamericans.org. Now you know the truth. And if you're like us, you won't be scared. You'll be angry. Angry that big insurance companies, right-wing pundits, and their friends in Congress have flat out lied about health reform, hoping to scare seniors.
But for the big finish of this picture, we need you to play your part. Attend public events, rallies, and town halls. Talk to fellow retirees and family members. Tell your story. Distribute flyers, emails. Write letters to the editor. Call, write, or meet with your member of Congress. Like the cavalry in an old Western, it's time for seniors to set the record straight and stand up for health insurance reform.
I'm Barbara Easterling of the Alliance for Retired Americans.
And I'm Gerald McEntee of AFSCME, and thanks for watching.
On behalf of the Alliance for Retired Americans, it is my pleasure to introduce to you a very special person with a very special message for seniors on health care, Linda Johnson Robb.
I want to thank the Alliance for Retired Americans for giving me the opportunity to speak to you about one of the greatest legacies of my father's presidency, Medicare. I have been greatly distressed about the tone of our nation's health reform debate in recent weeks, and in particular about the way Medicare is being maligned by the current debate. Those of you who lived through those splendid achievements of the Roosevelt, Truman, Kennedy, and Johnson administrations can be proud of the achievements of those years, including the creation of Social Security, Medicare, Medicaid, and more. In 1965, my father signed Medicare and Medicaid into law, providing national health insurance for seniors and the needy. Upon signing the bill, he presented the very first Medicare card to former President Harry Truman, who advocated for health insurance for all. Neither my father nor those other great presidents would say government can or should be the solution for every problem, but they would say that ensuring all Americans have guaranteed affordable health care is the missing piece of the modern American social contract and the unfinished business of their legacies. Without government, we would not have Medicare for seniors. Now government should step in to extend health insurance coverage to other Americans. This is also the unfinished business of our generation. I urge America's seniors and all Americans to finish this chapter in this great unfinished project of our society by working for affordable health care for all. I urge you to reject the falsehoods being spread by those who stand to gain from the failure of health care reform and those who simply don't realize what's at stake there. My father overcame similar opposition in the fight for Medicare. With your help, we can overcome again and create a new legacy for the generations to come. I want to thank the Alliance for Retired Americans for their leadership in protecting Medicare and advocating for health care reform. I urge you to join and support the Alliance's effort to make health care a reality for all Americans. Finally, I want to finish this message, not with my words, but with the words of my friend, the late Senator Ted Kennedy, who made the case best in his final National Political Convention speech. I'm Linda Robb. Thank you for listening.
And this is the cause of my life, new hope, that we will break the old gridlock and guarantee that every American, north, south, east, west, young, old, will have decent, quality health care as a fundamental right and not a privilege. This is what we do. We reach the moon. We scale the heights. I know it. I've seen it. I've lived it. And we can do it again. The work begins anew. The hope rises again. And the dream lives on.